Diagnosis according to Qi, Shui, Jin-Yang imbalances. Shui Stagnation Part 2. Etiology. Shui stagnation can arise as a consequence of virtually all chronic patterns of imbalances. Qi stagnation, heat, cold, phlegm, qi shu, and shui shu are often precursors of shui stagnation. Physical traumas and operations always create a stagnation of shui. Symptoms and signs of these are sharp pain that are localized to one place, pain that is sharp, piercing, or stabbing, pain that is worse at night or after the person has been physically inactive, limited or stiff movements, bleeding, long menstrual cycles, painful menstrual bleeding, dark and clotted menstrual blood, sharp chest pain, irregular cardiac rhythm, dark facial complexion, altered pigmentation, dark lips, dark nails, rough, flaky, thickened, or dry skin, physical lumps and knots in the body's tissue, numbness or sensory disturbances, purple skin, purple blood vessels, navy or varicose veins, psychosis, depressions. The ear is tender or painful when it is bent, doubled, and squeezed. Purple or dusky tongue, swollen purple sublingual veins, choppy, wiry, confined, or knotted pulse. Key symptoms are sharp piercing or stabbing pain, limited or stiff movements, dark lips, swollen purple sublingual veins. The treatment principle would be to circulate shui, disperse shui stagnation. The acupuncture points is to choose from urinary bladder 17, spleen 6, spleen 10, which are Jingwell points and local points. The needling technique would be to drain, bleed Jingwell points and small purple vessels in the skin. The use of cupping, moxa, gua sha, and 7-star needles is also relevant. Further explanation would be to use urinary bladder 17, spleen 6, and spleen 10 to move shui in general. Jingwell points activate shui in their own channel when they are bled. Bleeding spider, navy, and stagnated blood vessels disperse shui stagnation in the local area. Relevant advice. As with phlegm, it is vital that the underlying pattern that has been involved in the creation of blood stagnation is addressed. Shui stagnation can prevent the circulation of Wei Qi in an area where there has been a physical trauma. It is therefore important that this area is protected from the environment, so wind, cold, and dampness cannot invade the area. It is typical that joints where there has been an injury or an operation are often sensitive to changes in the weather. Physical activity is beneficial because it will circulate qi and shui, but it is also important not to overburden the area or force a joint to move more than it will. A joint or a limb should not be forced to move beyond a spot where a sharp pain is experienced. Doing so may cause further blood stagnation. Blood stagnation can be caused by the following patterns of imbalance: qi stagnation, phlegm, shui shu, qi shu, cold, heat. Shui stagnation can result in the following patterns of imbalance: qi stagnation, heat, phlegm, and shui shu. Thank you for your attention.